here. And today, our very special guest is Dr. Shibu Vijayan, who has contributed to advancing the fight against tuberculosis not only in India but globally as part of PATH earlier, and now he is at Qurai, one of the voices of reasons in the crusade to end TB. And India has promised to deliver this goal of ending TB by 2025. Welcome, sir. And we want to know where are we in this quest to achieve this goal of ending TB 5 years ahead of what the the global goal is, and we have 45 months left for it. So we would like to hear from you.
It's a pleasure to chat with you. So India took the global leadership, I would say, in predating the ending TB targets, and we had a very robust national strategic plan and financing for it, taking the lead, and also like including all sort of novel instruments and option and an appetite and an appetite to innovate, and we've been scaling it fast. I think that journey was kind of hurdle. I mean, there was a burden of COVID came in, and then we had a setback in that. But I'm looking at the very recent reports coming out from this. It's been printed, and if you look at the broader figures of case finding, India has actually been going back to the targets of like 21 cases notified. I think that we even probably like we'll go up beyond it. So the case finding side, we are actually doing good. So when I'm saying case finding, because of increased focus on engaging the private sector, increased focus on decentralizing and integrating with the health and wellness centers, because that's the focus of Government of India's Ministry of Health's vision to have pivoting our service delivery on health and wellness centers. So I think we are in that direction, because when you kind of get into the community level, the things will fall in place, and all these things are connected with the digital architecture right now, wherein the push for ABDM to get a digital ID for the patients, and also linking that with e-Sanjeevani, which enables and empowers the peripheral health staff, which is the health and wellness centers, I would say, are in the right direction. So if I need to ask them, so we are not there on prevention. We have setbacks. Not only us, globally the prevention goals has been not achieved. It is only roughly around 30% of the goal achieved as set by the UN high level mission, and we also contribute to that actually. Achieving that goal. One of the key reasons where couple of years back only we kind of had focused on the prevention aspects. Our initially, because that was day zero, you'll get it. Then came into the picture of following up with the contacts, childhood contacts, providing them with the INH prophylaxis, which was a struggle because to convince the parents when okay there is a risk of the kid, there were not enough tests to prove that the kid is infected. So a lot of challenges there, and 2 years back, Government of India opened up that to the family contacts, irrespective of the age group. So all age group which are contact to the family has been targeted for providing, especially on the preventive treatment. And on the same bread, Government of India also requested the partners to come into play, and which includes the JEET, Join the First to Eliminate Tuberculosis. Earlier version was the private sector engagement, actually now repurposed into preventive services, focusing on both public and private, and pretty much covering the entire India. Half of India is now catered by Government of India's NTEP services. Half is supported by the I won't say that is we are done everything on prevention side, but that is I would say that we move beyond the baby steps. We have systems in place. We know how to do it, but we are lacking some accurate tests, because one of the things is that we have to convince who are normal people to solo drugs for 6 months, because unfortunately we didn't have full India to be covered by the shorter regimen of which is rifampicin containing. That is in the pipeline, and there are districts where it has been used. There are states who prepared on with their budget to scale it up, but that's not optimal. So I would say a test which can accurately predict that you are at risk because the test is positive, which is now available now. fortunately made in India, the TB skin test by my lab and Serum Institute co-produced it, and which will go in probably will go into kick the field maybe very soon. Probably, I guess that will be one of the biggest announcement during the World TB Day as well. Along with that, now the vaccines are in the pipeline. So I would say both this test, which is more decentralized test, which is not expensive as IGRA test. Then the drugs are also coming. Drugs are going to be manufactured in India. Lupin is going to do that. So the cost will come down. That is one of the major burden for the governments to procure it. So that come down. And the vaccine which is in the pipeline, which will probably hit, I'm hopeful maybe by end of this year, we'll have something to offer. So all these things will drive down the epidemic. And we probably I'm very optimistic in the sense we can achieve it in 2025. We also need to see the other side of it. So on the case detection, there is a increased thrust on X-ray. Why X-ray? Because 40%, 43% of the cases which we have found in the prevalence survey were not coffee. These patients were identified by X-ray, and then subsequently sputum was tested with culture, and they become positive. So globally, also there is a lot of trust on these people are classified as subclinical tuberculosis. And early studies are saying that also contributes to almost 50% of the transmission of existing. Because these are not asymptomatic, this is not identified as a sick patient or a TB patient. So general precautions around cough hygiene and all these things are not followed. So they are in the community, they are in the household, and they are also not perceiving. So that the increased trust on sensitive tools like X-ray, the cuff app, which is in the again the pipeline, probably will able to differentiate between TB and non-TB cuff. Along with an X-ray, will have an accurate amount of diagnosis will be accurate. And now the global goal also to global plan to NTB also is pivoting on early diagnosis. So earlier it was okay, you have to diagnose and notify. Now it is actually pivoting on early diagnosis. So this early diagnosis is enabled by the X-ray thing. And now we have, so in a country like India, where everywhere we don't have in radiology read and X-ray. So globally, WHO guidances are now available for using artificial intelligence for reading X-rays, and which is available in India also. These are all Indian-made solutions available. So I would say, and now we have ultra portable handheld X-rays available, manufactured in India. So I think that these are the partnerships, these kind of partnerships, government of India should need to look up to and then facilitate. Okay, fine. Where are the solutions in India? Can we bundle everything together? Can we actually move to the community and start our service delivery very close to the community? So I think that's the way forward. To summarize, we have the right tools, we have the right systems, and we have the right attitude and the political commitment. What probably we are lacking or slightly lacking behind is the ownership from the sub district level or at the panchayat level. So that is something which we need to work together with the state and then local governments to get this thing accomplished.
Okay. Thank you for the very positive news which you
Yeah.
are sharing, and your optimism, I think, is infectious now, and
Yeah.
making me also optimistic that we can do it. But again, as you mentioned the BCG vaccine, and then you are talking of the newer vaccines which are so, and then you also said that the precautionary or the prevention of TB, the tools we have, we need to have an uptake for that.
Correct.
So, if you share your journey about the existing BCG vaccine, which of course at least prevents from severe effects of tuberculosis in children, when we started, what has been the journey? The uptake was, I think, about 4% in the 90s, and now it is around 90%. So, how was the uptake increased, and why is it still not 100%? Is my question.
Yeah, so any service delivery depends upon the quality of the health services which we are offering. So over the period of time, we have seen that the deliveries are happening and the household has now changed to the facility based. So, and zero dose BCG is actually a facility function. So if you are not delivered in the household, or in the facility, you won't get the chance to do it. So though there is a window period of 45 days, we can give it. So that is again, I'm just coming back to that point of like when we are empowering your health system, and there is a fortunately the COVID has taught the world to kind of focus on your primary healthcare system. So that impetus is also there. So the government of India's initiative to, for again, health and wellness centers and empowering PHCs, bringing in health infrastructure through 15 Finance Commission, which is a huge amount of money pumped, and which is exclusively for health system development, and states are accountable for it. I think I would say this 90% will probably bump up to 100% very soon. And also COVID, what other thing COVID taught us that to have the supply chain straight. And so India is a country where vaccination has not been started now, because our polio example is the right example. We have community systems as well as we have the health systems. We worked in tandem and then we eliminated polio. So it's not a country where there is a general perception, okay, we have done everything and we are away from the vaccine. So we are in the vaccine world. So we have the right behavior to adopt that vaccine and get it, and that we have demonstrated in COVID also. So coming back to your question on the adoption of the new vaccine, probably in the pipeline vaccines, which I am hearing the research is around adolescents age group. I would say the COVID experience is again probably help us in kind of convincing that population, and because we have gone through that series of COVID vaccinations. Now it is in the booster thing is happening, though it is optional. The uptake of the booster is low. I should admit
Yes.
that. I would say the health system preparedness, what we have done for COVID, which was both public and private, should be leveraged for the BCG vaccine, repurposed the BCG vaccine for adolescents. And that experience, again, the optimistic in me is saying that that learning from the COVID certainly will help us in. So here, what happens? No, now we have testing for TB. We know that infection testing, the TB skin test is available in India. So I'm just assuming I'm going to a household, or where there is a positive patient is there. I'm screening all the contacts with X-ray and looking at segregating them. Is okay, this is a shadow, and then test for TB. If there is no shadow, TB test is positive test for infection. Offer, and if it is not infected, give injection. Give the vaccination, and if it is infected, give the uh, prevention drug. So it's a complete package now available. It's a matter of like how do we roll it out? What is that package is going? How are we going to bundle it together? Are we going to segregate it into different health systems as responsibilities? That is something which we need to test and try and then deploy and scale up.
Important thing is also, I think, that we do not forget the lessons learned from COVID-19 vaccine rollout, or even
Correct.
the current BCG
Correct.
vaccine rollout,
Correct.
and we learn from our mistakes and we move forward. So, would you say that the community has to be prepared from beforehand to accept and to just remove that vaccine hesitancy which is there in the public for a variety of reasons,
Hmm.
maybe for different
Yeah.
vaccines? So once, hopefully, I am your optimism has reached me
Yeah.
also. Hopefully, if we get these new vaccines approved, and so before they come in the market to be rolled out, should there be enough preparedness in the community, and how to go about it?
Absolutely. I think that is something which any vaccine or any new intervention need a
Yes.
community engagement upfront. I would say rather than going and actually pushing down, information. Sorry, interventions to them, we need to prepare the community, and this is the right time to do it. So I would say the government of India should focus on a vaccine rollout plan from every state now. So because if they are thinking that okay, we are going to get something, and prepare the states from local self government level or primary health center or health and wellness center level and higher up to get the ownership, teach the community preparedness. So one of the main reasons I was part of a vaccine hesitancy study.
Yes.
So what we realize that many of the time it's not about the knowledge about the vaccine efficiency. It's more about how the health system treats you. So, which includes the atmosphere where you take the vaccine also. So, one of the story when one lady actually narrated to me was when she were lining up for the vaccine, and she's from a very lowest quintile of socioeconomic status. She got a feeling that I'm getting into the jail because she has been in the jail for a few days. So she got a feeling that the health system is not so accommodating. You are actually put it into a narrow room. People are staring at you. You have been because you're not dressed up well. So these are factors health system need to be conscious about and cognizant about, and kind of customize your approach to the patient and the level they are coming from. So that is where we fail in. I would say the health communication in globally it's a failure. Yeah. So we are not able to actually rightly communicate and segment the population accordingly and then message it in the right way. So that is where one is messaging and also providing the right environment. So if they are comfortable at home, we should be able to deliver at home. So that should be the approach. So we need to understand. So now, fortunately, TB community is focusing on vulnerability mapping, which individual vulnerability mapping. Because we know at each household who is vulnerable. So that is the data set that the health and wellness centers to focus on and say, hey, you guys are going to actually, there is a new treatment coming from government of India. We need to prepare and educate them, and this is the right time to do it. So perhaps there's any big announcement are coming from the government of India during the World TB Day about the vaccines, and then immediately after that, when before the vaccine hits the health centers, there has to be a lot of iteration of communication and engagement with the communities. The grassroots level need to be there, and which is not a health system function, I would say, which is health system is part of it. But it's a comprehensive, I would say, local self multi pronged approach, multi system main approach need to be there.
And also, I'm sure you would agree that removing stigma and discrimination, not stigmatizing a person, which happened in COVID
Correct.
quite often. And
Correct.
I think that is one of the lessons that
Hmm.
keeping the human rights perspective and otherwise also, like don't discriminate or stigmatize
Correct.
us.
So that again, I mean, building on to that, there is something called treatment support group,
Hmm.
which I mean, I'm from Kerala, so which actually kind of budded there, the concept budded there, wherein a patient detected in your community, the local self government owns it, and they were given a different, I mean, special status, wherein including the local ward member, the social service team, the self help group, the village officer, the police station member. There's a people friendly policing. So all these things are actually a committee to support it. In Kerala, it is possible with the number of patients are less. So there is a government of India thrust is to actually kind of replicate that kind of systems uh, on existing community systems to kind of help the patient. So the larger move to this adoption of patients move, which again is I would say, which enable community to see, okay, these are people need support, we need to care them. So that message is going, and I won't say that we cannot 100% take away the stigma. So that will be, there'll be a lot of stigma around, but the measures the ministry is taking, the community, the larger corporates are actually now coming, forthcoming to be supporting. All these things will certainly kind of dilute the stigma to a large extent.
Yes, yes. And Kerala, yes, you're talking of
Yeah.
Kerala, but that is a role model state.
Yeah,
So, and if that model can be replicated, irrespective of the number of patients
yeah.
or the the type of health delivery, the number of
Hmm.
people requiring not only tuberculosis services but others, I think
Correct.
that again becomes a state this thing, and of
Yeah.
course, Kerala is a role model to
Yeah.
follow. That's great. Okay, and your message for World TB Day, I think we cannot end without your message for this World TB Day.
So I would say, because there is a personal agenda also in that.
Yes.
I would say go and get your X-ray done and then make sure that you are not infected. That's my message. And yes, we can end TB.
Thank you very much.
Thanks for having me here.
We were in
It's a pleasure.
conversation with Dr. Shibu Vijayan uh, from Kerala, but a global authority on control of TB. Thank you.
Thank you so much.